Some public health experts and scientists now believe that the US is unlikely to reach herd immunity and that the coronavirus will instead become a manageable threat that circulates for years. According to a New York Times report, the US is unlikely to reach herd immunity anytime soon, as more contagious COVID-19 variants spread across the region, and many Americans continue to remain reluctant to get vaccinated. Earlier in the pandemic, scientists had estimated that herd immunity would be reached when 60 to 70% of people get immunized either from prior infection or immunity through inoculation. A year later, that estimate has now risen to at least 80%. This is largely due to a highly transmissible new mutations of the virus. The predominant variant now circulating in the United States, called B.1.1.7, that was first identified in Britain, is about 60% more transmissible than the original virus. Experts say continued immunizations, especially for people at high risk, will be crucial to limiting the severity of outbreaks. In addition to new variants like B.1.1.7, vaccine hesitancy also plays a role for not being able to achieve herd immunity. Polls show that about 30% of the US population is still reluctant to be vaccinated. Although resistance to the vaccines is a main reason, the United States is unlikely to reach herd immunity.